Follow us on Facebook, Africa Global Radio, on Twitter, AF Global Radio. If you're doing the listening right about now, when you're about to tweet at us, use the hashtag The Africa Daily Show. I am Barry Musa. Ape is getting ready for good news across Africa. Don't go away.
Good news.
Good news.
Good news.
Good news.
Okay.
Okay, so we have, well, as usual, 3 good news stories, but we'll be starting with the first one, and that is in Senegal.
What's happening in Senegal? Tell me more.
Well, it turns out that Senegal has actually kicked off the COVID-19 vaccination campaign.
Right. Okay.
So today they've been able to get hold of a number of the vaccines and 200,000 doses of the COVID-19 vaccine. This is the one from China.
Oh, okay. Nice. Right.
It's the Sinopharm. And
Yeah,
I
okay,
mean,
yeah.
Well, according to their finance minister, they're able to purchase the 200,000 doses for about $3.8 million US.
Wow. Okay.
Now, I like the fact that they're looking to be able to work on saving the lives of the people. Yes,
True,
'cause
true.
For the president, they actually televised receiving the vaccine on national television.
Okay.
Yes, and President Macky Sall was there. And one thing he said was that the urgency for them today was to protect their healthcare workers.
Right.
And then also those above 60, the aged. And then those who live with comorbidity, like patients who have 2 or more diseases in their body.
Wow. I mean, look, COVID is a serious issue. For the fact that the president has to go to the airport to go, welcome, the vaccine is a big thing. It happened in South Africa as well. I mean, President Ramaphosa was also at the airports. And unfortunately, that vaccine is not actually working anymore. Not working, but not efficient as it was. Anyway, let's continue.
Well, they've already started putting it out. They're looking at first vaccinating the first 3 categories I stated, which
Okay.
is the above 60,
Right.
the healthcare workers, and those who have 2 or more diseases in their
Right.
system. Now, the World Health Organization actually gave them 1,117 approved freezers.
Wow.
Okay, no, they didn't get it from the World Health Organization, but it's approved by the World Health Organization, the type of freezers. 'Cause
Okay.
let's not forget the vaccine is temperature sensitive.
Yeah,
Yes,
yeah,
so-
true. So the ones they have in Senegal.
Approved, yes, by
Okay.
the World Health Organization.
Okay.
So this have already
Beautiful.
been installed across the country, and that's where they're going to send the vaccine straight
vaccines?
off, and then
Right.
they'll start working on it. Yeah.
Super. Good news. I just hope our what do you call it? Our fellow people in Tanzania, of course, from the president, will also see things differently. Maybe get people vaccinated and everything. Okay.
Well, for a total, they're looking at being able to acquire 6,790,000 doses, which would allow them to begin the mass vaccination.
All right.
But I think this is good news. I'm happy in the first place that they're actually making steps to be able to curb the spread and save lives as well, because Senegal has recorded almost 32,000 cases of the COVID-19, and they
Right.
have lost, well, when it comes to death, 760 people have died.
760
Yeah.
people. Okay.
So I think this is more like a stitch in time saves 9.
Yeah, because you don't have a choice. You wouldn't say you don't trust the vaccine, so you're just gonna wrap. What do you have? The question you should be asking yourself: what do you have at the moment? Right? Okay.
Okay, so not to stray far away from the whole vaccine thing, we're moving to South Africa,
Okay.
and we're looking at the whole vaccine freezer thing. So
Right.
a South African freezer, which looks like it's going to be a game changer for the vaccination.
Okay. Tell us how that works.
So there's a South African natural gas company, Renegen, and they are using their knowledge of cryogenics
Okay.
to develop an ultra-cold biological transport freezer.
All right.
It's like a prototype. And they just want to use it so that they can maintain a constant internal temperature between 8 to minus 150 degrees Celsius for more than 25 days. And without the need of external power sources.
Okay.
Now, I think we know when it comes to power in South Africa, I mean...
There's
we
an
know-
issue, eh?
Yeah, we know it's
Recently
not
we talked
a
about it
smooth
again.
part. Yeah.
Not good.
It's
Anyway.
not really a smooth part. So for them to actually be looking at being able to do something like this, I think it's great news.
Right.
Because temperature, the minute there's a switch in temperature,
Yeah.
it really does affect the thing. And
Yeah.
I think one thing we need to talk about is the importance of the temperature sensitivity, because people don't realize, but it's like, why do we need freezers? Now, if there's a slight change in temperature, when you actually use it, aside from the fact that it may not be effective, you do get certain side effects.
Right.
So that's where the whole temperature sensitivity thing is
comes
important.
in.
Exactly. So for them to want to find a way to work on a freezer that can maintain the constant temperature for over like 25 days straight. That means you can transport it during that period to different parts of the country, no matter the location,
Right.
and not be bothered about it being connected directly to power supply.
That's very interesting. I mean, considering the fact that, yes, you mentioned power issue in South Africa is an issue, and then the vaccine that you go in for will determine the kind of power supply you need and the freezer you need to keep it, in check and all.
Yeah,
Oh,
so
that's
there's like a mobile freezer.
Okay.
And their main target is how to transport the vaccines to rural areas.
Right.
Yes.
Okay. Good move.
Very good. I think it's an amazing thing that Renegen is doing. And
Right.
this is not the first time. They've also done something similar we've spoken about here on the show. I've forgotten what
Yeah,
exactly it
Renegen,
is.
right?
But then, yeah, they're doing very amazing things. And I'm happy about the fact that it's locally initiated.
Right,
It's the
right,
whole
right.
originality is coming from South Africa itself.
Okay.
Well, that's what we have on the COVID level. Now we're moving to Cameroon, where we get to actually look at how to fight malaria. And
Malaria.
this
Oh,
is
dear.
where we look at a Cameroonian inventor, and she has actually come up with an atypical larvicide to fight malaria.
Larvicide.
Yes, so most of it I know about the mosquito sprays, mosquito nets, mosquito coils, like everything I know in the fight against malaria is targeted at the mosquito. The
Okay.
fully grown mature
Oh,
mosquito that
yeah.
is
Is it
literally going to
Yeah, the
Anopheles.
female, stuff. Yeah.
That is literally going to, give me the malaria, the whole malaria when it
Parasites
actually
and
gets
all.
to me.
True.
But what Agnes Antoinette Ntomba is doing is different. She's actually looking at killing the larva before it actually even grows to become a mosquito.
Oh, okay. But how do you identify where they? Okay, on water bodies, I believe. Maybe, because that's
You-
where I think
you
they
did
lay
science?
their eggs.
You did science.
I should have become a doctor. How did I miss this sign? Epi, thank you. I think I need to go back and well, Joe, when you build your time machine, let me know. Continue, Epi.
Joel is not looking to travel anywhere.
He's not going to do that. We are the ones. We are the experiments. I mean,
I'm just saying, if you're looking to Joel to
I'm willing
actually
to
build a
volunteer
time-
me. But then tell us, very interesting bit right there, larvicide. Let's see how that
Yes,
works.
so one thing that Agnes first identified is the fact that malaria is a big issue when it
Okay.
comes to Cameroon. It's actually killing a lot of people. A lot of lives are being lost. And they have the mosquito nets, they have the mosquito sprays and stuff. And some
It's
people,
not
to the
working.
extent, are even using pesticide and things.
Right,
But then
right.
she was looking for a medium that is effective and not harmful to the human health or the environment as well. So she came up together with this. It's not different, or it's not the first time something of the sort is happening, but her use of nanotechnology, nanoparticles in her research
Nanotechnology.
is what made her stand out.
Right. Okay.
Yes. So one thing she looks at, she's just picking plants. The main thing she's using are plants.
Okay.
Yes, plants is what she's actually using to come up with the larvicide that is killing larvae. She's
Okay.
done test trials and she's actually been awarded a lot of medals. Like basically everything was conclusive and it works. She's now looking on how to put it on an affordable scale so that everybody can be able to, purchase it and
Okay.
then they can solve the whole malaria issue in Cameroon. But it's amazing the kind of solutions we come up with when we sit and identify the problems we have. Now, she being a woman, first off, is something for me. She being an African is also another thing for me. Because, she's brought two things together, broken barriers and Cameroon. No disrespect, but Cameroon.
Not even about that. I mean, lately, some articles publishing issues, the Anglophone part against the English-speaking part and everything. There's a bit of unsettling, issues right there. And Well, it wouldn't, stop people from trying to be innovative and come up with solutions.
And I
Problems
feel
they're facing.
I feel that if more opportunities given, a better platform is actually put out there,
Right.
would have more and more of these people coming out. I mean, she didn't need to go to the big names to study there. She just had to identify the problem and do her research
Right.
and work. And she was actually still a student when she was just doing this and putting together this whole solution for it. The only funds and help she got was from family and friends, and then her school's lab. That was
Yep.
all.
So this should actually send a message to our big people up there. If this she can do with the little resources she has, imagine what she can do with the bigger ones.
Yeah.
Great effort.
So her efforts have actually been recognized by UNESCO and by L'Oreal Foundation as well. She's actually listed among the young 20 women scientists. Yeah, yes. So it's a good thing. Kudos to her. We hope to see it, being carried up to
Yeah.
another level. I think when people come up with ideas like this, the government should pick up and support
They
it
should
and make
celebrate
it work.
her on
Actually,
African Champions, maybe sometime. Would you think so? She deserves it. She deserves it. Okay.
well, that's all we have for good news.
Great. The show is Africa Daily on Africa Global Radio. You just heard the voice of Abe, and I am Barry Musa. So log on to africaglobalradio.com. More and more and more countless positivity on the website. The news item ranging from the diaspora news, the African news, and of course from Albe's Ghana. And just to put this out there, it's not just about the good and everything. It's about sometimes challenges, the identification of the challenges and the solutions that are being done to address them.